Welcome back to Daybreak on this 26th day of May 2020. Of course, it's been about 75 days since the coronavirus cases were reported. The first case was reported on the 13th of March 2020. And of course, the numbers have been rising, and especially in the month of May. I want us just to start by looking at where we are. That is the state of the war with the slides that we have. So far, we know that the total number of cases that have been recorded in the country are 1,286. Those are the total infections. Out of those, 402 have recovered from the virus, 52 have died, and therefore those that are treating the virus are 832 at different facilities across the country, some of them in critical stage. This has also, the past 1 week has also been the worst week, because on the 17th of May, this was a Sunday, the number of cases were 887. As of yesterday, Monday, the 25th of May, they were, as I said, 1,286, and therefore there's an increase of 399. But it may also be a good week, because those persons that have died have only been 2. The previous week, 18 died within 7 days. Apart from that, we're looking at the numbers and how they've been progressing in terms of the weekly tallies. The first 10 days of the virus, 15 cases were reported. After that, you see the number went to 27, then 100, then 55 in week 4. Then from week 5 to week 10, it has been a steady rise, but it has grown exponentially between the 8th week and now that we are reporting 327 in a single week. This is the highest number that has ever been recorded since the journey of COVID-19 in Kenya was reported or started. Then in terms of months, this is also the worst month in terms of how many cases have been reported. You can imagine that in only 25 days, 890 cases have been recorded. So we do not know whether this will continue to be the trend. And to speak to us this morning is Daniel Yumbia, who is the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council. Good morning, Mr. Yumbia. And of course, we're looking at the numbers and getting concerned. I mean, how does this feel when you're looking at it from the perspective of the KMPDC, as well as this fraternity that has been managing the crisis that we have in the country?
Good morning, Sam. The trend is worrying. It is a major concern, given that we are still not at the peak as anticipated earlier on. I only have to look at it from the perspective that Kenyans must adhere to the guidelines that have been given by the Ministry of Health. If we are going to flatten the curve, then it calls for concerted efforts from every person. We need to ensure that we follow the guidelines strictly, and particularly for the people that have been tested and they've got to be followed. We're looking at contact tracing. You realize that currently we've done contact tracing for about 6,229 contacts. And out of that, following contacts, we've got 181 who have been confirmed positive, which means the contact tracing is a major concern to us. And we have about 1,679 persons who are on follow-up. I must say that we are now experiencing a challenge in that as of yesterday, about 60 persons had given contacts that were not correct. So we're having a challenge of tracing persons using the address or the telephone numbers that they give. So I'm appealing to Kenyans, once you go for testing, please give the correct telephone number so that we can follow, because if you get out of 6,000 contacts following, you get 181, that's a considerable number. And if you get about 60 persons not being reached, and these are people who need to be followed, then it becomes a major concern.
That's very interesting that you should talk about those numbers. But just for clarity's sake, when you talk about 181 people have tested positive after contact tracing, what is the global number that you're talking about? How many of these people have been quarantined since the start of this pandemic on the 13th of March?
I must say that from contact tracing, we have quarantined about under 600 from contact tracing, but contact tracing persons are not being taken to quarantine straight away.
Okay.
We have got a limit that under 5 years, children are not being taken straight to quarantine unless they are going for isolation and treatment. Over 65 years, still we are not taking them to quarantine. So the age limit is that, and people with the comorbidities, people with existing medical conditions are not being taken to quarantine. What we are trying to do is we are isolating them in their own environment, particularly those living in areas where they can be isolated from the rest of the family. Those ones we are allowing them to stay within their own environment, and those that cannot do not have the amenities or the facilities for self-quarantine, then we are subjecting them to be taken for isolation and to quarantine. Sam, let me say that when it comes to quarantine, we have developed protocols even for home quarantine. And we are not telling people to take mandatory quarantine as a threat to their own existence. We are looking at protective quarantine. We are encouraging people also to take it positive and realize that when we take them to quarantine, we are taking them to quarantine for their own good, for the good of the nation, and for the good of their families.
Right.
Therefore, to be taken to quarantine is not like death sentence. It is just that we cannot allow somebody who has probably returned from overseas to mix with the other persons without being subjected to quarantine and mandatory testing.
Right.
Recently, we got repatriees from
before we get to that, I want us to a little bit focus on the situation that you're talking about, the 60 persons you've not been able to trace. Exactly, how does this happen when now you've identified a positive case, then you want to do the contact tracing? How does it happen? Are you able to verify the contacts before making that visit or making that call?
Yeah, we do have a multi-agency team which has been put together. And for example, when you go for testing and you've given your details, we use that number to contact you. And once you have tested positive, you are taken through counseling. And once you have been counseled and you've been talked to, then the next step is to inquire whether you have been in contact, or the persons that you have been in close contact within the proceeding 10 days or 7 days or 5 days.
Right.
So you need to give that information without being pushed. And once you have given that information of the persons you feel you've been in close contact with, those are the people you've got to follow and ensure that they are also tested, and quite a number of the people that are followed having a close contact to the persons, they do turn positive, and others are negative. And therefore, depending on the level of exposure, the contacts are evaluated.
Right, and now we are reporting 1,286 cases. Of course, some of them will be from the contact tracing that you're talking about, but are you certain that you've been able to trace every person that may have interacted with these patients that you're talking about now? Have you been successful to do all that?
In the past years, it has been a very great success, because once you give the details and you know for sure you are protecting these persons, and the information you give is correct, we use the telephone numbers to contact them, and others we also use the signals and trace where they are. But of late, people are giving wrong telephone numbers. Now, that is a bad practice.
Do you know the motivation?
Pardon?
What's the motivation of giving wrong contacts?
you are a Kenyan, I'm a Kenyan. I wouldn't know unless we get one and they explain why they are giving that. But somebody wants to be not to be traced at all. So it becomes difficult. It's a careless thing, I would say. It would be very wrong for somebody to do that, because if you are found to be positive and you are being called upon to be taken to hospital, and you are being called upon to be separated from the community, and you give the wrong conduct, then are you helping us? No. Are you helping yourself? No. Are you spreading the disease? Yes. Therefore, you are actually a threat to the society. And Sam, let me tell you, in as much as the government is not disclosing the names of the people who are negative, who are positive, because of doctor-patient relationship, CAP 253 also allows us to disclose patient information if the patient is a threat to the nation, or to the society. Therefore, they are trading on dangerous ground. I must say that if push comes to shove, the government will have no alternative but to publish their names, so that we just make them public. So it's good for people, because once you're going for testing, you got your personal details probably through your ID, national ID, and that is how your name is recorded. If you give the wrong telephone number, and we have your name, and we want to protect your identity, please give the correct telephone number so that you can be approached as an individual.
And when you look,
if they continue giving wrong information, then CAP 253 laws of Kenya allows doctors, or allows hospitals, allows the government to disclose information if somebody's disease is a public threat, just like COVID-19 is. And therefore, they will not run very far. I think the government will consider, and the measures will be put in place to ensure that those who give wrong conduct details, their names would be availed to the society, so that they can be assisted, and so that we can also protect the society, because we have a duty to protect the society and the community.
And when you look at the trends so far, because there has been a nationwide curfew towards the end of March, that is 26th of March, there has been cessation of movements in 5 counties now. There has been cessation of movement in at least 2 neighborhoods. You're talking about Eastleigh and the old town of Mombasa. When you look at the cases that continue to be reported, what are those trends? Are these people that have traveled, or they're just people interacting within even those lockdown areas, especially in Nairobi?
One, we got the people who traveled into the country from countries that had experienced the disease, and they brought in the disease to the country. That trade has completely been controlled by the closure of the airport. Those who come in of late, the people are being repatriated. I was telling you earlier on that a team that was repatriated from Dubai, we put them into 2 quarantine sites, and when they were tested, 18 of them tested positive. So this is an indication that if we would have allowed those repatriees to go straight into the community, we would not have helped ourselves at all. And therefore, the idea of quarantining persons who return into the country from overseas still continues to be of great importance to us. Now, I can say that currently the percentage of the disease transmission from returnees from outside the country could be between 15 to 25% currently. But I must say that over about 70% is now community transmission, which means that we are not taking all the precautionary measures as stipulated by the Ministry of Health, and therefore it is important that those that have been put into closure, where cessation of movement has been ordered in certain areas, it must be adhered to appropriately. Because as long as people do not adhere to that guideline, then there is the risk of community infection. I must say that the places where cessation of movement has been imposed, there has been a significant improvement in terms of transmission. And then the data that is available to us indicate that cessation of movement has greatly assisted. Let's look at the curfew. And you know, when people go to social places, look at the bars and the restaurants,
right?
You cannot control how they will intermingle, and therefore that curfew itself is really assisted a great deal. And even the closure of mosques, the closure of churches, the closure of large gatherings, I think that we must appreciate is the right way to go.
Mr. Yumbia, of course, all those measures have been taken, but the cases continue to rise. In the month of March, May alone, we are reporting 890 cases. So despite the success that you're talking about, don't you think it would be important to give this information of how these new cases are being transmitted so people know, despite the curfew and the other measures that are taking in place, these are the likely channels that you might get this disease?
Thank you. What I was trying to say is that it could have been worse. It could have been worse. In fact, our projections, the projections that had been given would have hit the 10,000 mark by April, and we didn't go there because of the measures that were put in place. I am just indicating that failure to put on a mask, failure to wash hands frequently, failure to keep social distance, failure to adhere to lockdown areas because people are still trying to evade the police roadblocks so that they can access areas that are restricted.
Right.
Failure to keep social distance by people still going to small parties. You remember the other time we discussed of about 400 persons who had been arrested in Nairobi for failure to observe curfew hours, people being arrested hosting parties, people going to drinking sprees in their own communities. So that's something that has to be looked at as an individual responsibility. I don't want people to look at it like they are doing this for the government, because there are people who are putting on masks because of the police. They fear the police.
And of course, that is the wrong thing to do.
That's a wrong attitude.
So let's talk about
to protect yourself, but not to, just to avoid police arrest. It is improper for you for a Kenyan not to wear a mask simply because they feel that in the event the police are near, they put it on. The mask should be put on as long as you are in public places. That is a must.
You need it to protect yourself. Let's talk about the capacity, because sometimes last week we had the the Council of Governors indicating that at least 40 counties had set up quarantine facilities in their areas. I think it's yesterday or the day before we had the Minister of Health indicating that now we have quarantine facilities across the country. What is the correct position and what is the capacity at these areas, even as you talk about how many people are already in those quarantine facilities?
We have two types of quarantine facilities. We do have private quarantine facilities. In this case, we are talking of hotels. When you are being taken to quarantine, you have a choice. You can choose to go to a government quarantine facility, or you can choose to go to an hotel. And most of the hotels charge between $40, 4,000 shillings to 12,000 shillings. But government facilities charge between 2,000 Kenya shillings to 4,000 Kenya shillings. But the Ministry of Health has indicated that they will take care of the persons who are being taken to government quarantine sites.
Right.
So previously, people were being made to pay for the government facilities. For quarantine services at government facilities, and this has now been stopped.
Yes.
What we have done is that we have established a number of quarantine sites from across the country by Kenya Medical Training College. All the Kenya Medical Training Colleges across the country have been converted into quarantine sites,
right.
And about 36 are active, and the 24 are yet to be converted. Other county governments have also sought and established quarantine services or facilities within their county. So there is no county now which can say they do not have a place to take in people who have been traced out of conducts or people who require to be quarantined. I must say that the police are no longer sending people to quarantine sites because of breaking the curfew. They are being bonded and they are being made to appear in courts of law. But quarantine sites are being set up specifically for people who have contact with positive cases.
So what is the capacity and the active capacity?
The capacity now, as we speak, we can say that out of the capacity we have now from educational institutions, we have non-medical institutions, we have 4,500.
Sorry, say that again?
From non-medical institutions, we have 4,000, 4,600, and medical-related facilities, we have identified isolation treatment centers with a capacity of 2,600.
Right.
Yeah, so basically we are sure that with this kind of number, anybody who needs to be quarantined will find space to be quarantined.
And so let me ask, because currently you're talking about active cases being over 800, if I'm not mistaken on that. And these numbers, as you say, we are not yet at the peak. And in the month of May alone, we have recorded 890. So there's a possibility that in about 2 or so months, that number will surpass 2,600 in terms of the people that may need to be in isolation centers. What are we doing to expand? I know this is not the question for you exactly, but what are we doing to expand the capacity of these isolation and treatment centers?
Yes, actually, you're asking the correct person, because the Medical Council is involved in the evaluation and identification of treatment centers, stroke isolation centers in the country. Tomorrow, we are sending a team to assess a total of 50 facilities across the counties. So 50 facilities which are in hospitals. We have given each county a chance to identify one facility per county, which the national government is going to support in terms of equipment. And therefore, we will start our inspection on the 50 facilities tomorrow. And again, we are also inspecting 34 Kenya Medical Training Colleges, which have been used as quarantine sites to assess with the possibility of also converting them into treatment stroke isolation centers across the country. So we are looking at about a total of 84 facilities being looked into within the week, between tomorrow and next week, and they will increase the capacity. I think by the next briefing, I'll be telling you the number of beds that will have been established and the number of ICU beds. And I must point out that the way COVID is, about only 5% of the patients require oxygen or ventilators, and the rest would require hospital or normal treatment, wards, and separation. And therefore, there is no greater risk, but we shall make sure that at least the 5% who require ventilators do get that kind of facility.
I want us to start to wind up because you said that only 5% need oxygen support or ventilators. How have you seen the treatment regime changing since the 13th of March to now? I know early on we were being told that the teams are treating symptoms. Is that changing, and what exactly are we doing to patients that come and have tested positive of the virus?
I must say that that is a tough question on my part, because you need to get it from a clinician and they need to tell you what the regime is. But basically, what we need to say, we can just stick to the numbers that the majority of patients are discharged out of the normal treatment without being subjected to ICU services. And therefore, it means that our immunity levels are still high and we are still able to overcome the disease through the normal treatment. However, that does not mean that the government does not prepare for any eventuality, because as you can predict, we are going to the cold weather, and this cold weather comes in with colds, normal colds, and we also anticipate malaria outbreak at the usual places, and therefore this combination could be a challenge, and therefore we need to ensure that we have structures and stringent measures in place to ensure that Kenyans are protected.
Okay, all right. Thank you so much, Mr. Daniel Yumbia, Chief Executive Officer of the Kenya MPDC, for speaking to us about the state of quarantine facilities as well as the contact tracing. You now say that about 60 people have given the wrong contacts in as far as after testing positive, and therefore you say that those people that will be caught in such situations, the government has the leeway, if they may deem necessary, to go ahead and announce and publicly declare such people are COVID-19 positive. But then again, for you to avoid such a situation, you have to give the right contacts. So thank you so much, Mr. Yumbia. And up next, we will be speaking to the chairperson of the Independent Electoral Boundaries Commission, that is Wafula Chebukati. He'll be joining us from Nairobi to be talking about the situation to do with the state of the IEBC calendar. Of course, there are several issues that they were dealing with before the COVID-19 cases were confirmed. So we'll be talking to us on the latest to do with IEBC, as well as some activities that have had to be postponed for the meantime. So we're back with that conversation. You can send in your views or questions via 22422, or you can tweet us at Citizen TV Kenya, at Sam Gituku, at Zinzi_K. The hashtag to use is Daybreak. We're back in a moment. Oh, it's clear.